This is BetaLife, a place where you can get better health information to help you live a better life. I'm your host, Dr. Olawale Ogunlana, and I want to welcome you once again to today's episode. This program is proudly brought to you by BetaCare Limited, a platform that revolutionizes doctor and patient relationship. The journey of parenthood usually begins with pregnancy. During this 40-week period, the female body undergoes a lot of physiological and biological changes. For some women, this may not be a big problem, but for many others, especially for women living in developing or underdeveloped countries, pregnancy could be life-threatening. Now, this is where antenatal care, also known as prenatal care, comes into play. Antenatal care is provided in the form of medical checkups consisting of recommendations on how to live a healthy lifestyle and the provision of medical information such as the physiological changes that will occur in pregnancy, the biological changes that will occur in pregnancy, and the provision of prenatal nutrition, also known as prenatal vitamins, that help to prevent potential health problems and also promotes the mother and the child's health alike. According to the World Health Organization, it is recommended that pregnant women have at least 8 antenatal care visits to spot problems and to receive necessary immunizations during the course of pregnancy. This can, however, be individualized because for some women with complicated pregnancy, they might require even more healthcare visits. In Nigeria, antenatal care is yet to be adopted as a culture for pregnant women, and this happens for several reasons. In my own clinical experience as a medical doctor, I have realized that poor outcomes in pregnancy and childbirth are usually linked to poor antenatal care visits. Take, for example, eclampsia. Eclampsia, while very uncommon in countries like Europe and America, is very common in Nigeria. And this is a condition that can be discovered and prevented in as early as 20 weeks gestation. Low antenatal care visits account for why Nigeria has one of the highest maternal mortality rates in the world. Pregnancy is not a disease, neither is it supposed to be a death sentence, and that is the reason for antenatal care. To discuss the importance of antenatal care with me today is Adeyemo Oluwanifemi, who is from Preggo Mothers, and I'm glad to have you on the show.
Thank you so
You are
much.
welcome.
Thank you.
Yeah, so tell us a little bit about Preggo Mothers and what do you do?
All right, so Preggo Mothers is actually a platform that provides free antenatal care for pregnant mothers. It actually started during COVID. I think about March, to be precise, March, when COVID was declared as a pandemic. And I could remember that day when we had to call all pregnant mothers, that's the hospital where I work, to tell them that they can't come for their routine antenatal visits anymore. And the only time they could come to the hospital is if there is an emergency or if they are close to delivery. And that dropped a lot of burden in my heart. And I could remember that day while I was still thinking about the problems that could occur. All right, it just came to my mind that I could help pregnant mothers. So I thought about it and I put a quick structure into it and I created the page. And I also informed one of my friends, I have to mention her name because she really did a lot. That's Bamike of Big Brother.
Yes.
All right, and at that time she just had her own baby. So it was very easy for her to associate herself with the challenges that could come with pregnancy.
Yes.
So immediately she posted it on her page, and over 725 pregnant women joined our WhatsApp platform. So we had to divide them into groups. That was how we started. So every morning we open the WhatsApp page, and at night we close it so that we don't have quite a number of unnecessary messages. So and that was how we started. We're always attending to their problems, their challenges. They wake up in the morning, they say, "Doctor, I saw this, I saw that, what should I do?" And we're able to help them. So that was how Preggo and Mothers came to be.
My name is Dr. Alfred, and I'm a pediatrician. Nowadays, I get to attend to so many children, and it gives me so much joy and fulfillment, knowing that I get to take care of my patients.
Adding to the fact that at least 60% of individuals who seek urgent medical attention can get the same quality service at the comfort of their space without hassle or the fear of spending the whole day at the hospital.
Doctors are easily accessible while patients get better care. Sign up to our website at www.betacare.ng.
BetaCare.
Revolutionizing doctor-patient relationship.
That's a very fantastic story about Preggo Mothers. And the first question that I would just like to ask now is, when we talk about antenatal care, why is it so important? Because we are in Nigeria, a lot of people do not understand why some of these things are important. But in the context of Nigeria as a country, why is antenatal care very important?
All right, before antenatal care, there is something called preconception care, which people have neglected. People just get pregnant, and the next thing is they want to go on and start making babies. Before wanting to make babies, you should at least, people should come to the point where they say, okay, we want to make babies. What are the things we need to do? That's preconception care. So now, going to the question you asked me, now, first and foremost, everybody have the right to be bettered well, so that we can live well. Because according to research, quite a number of problems that human beings face after being birthed is as a result of the prenatal state, the intranatal state, and during delivery. So, and that is why for someone like me, I picked interest in mother and child health.
Yes.
Because if we can reduce the problems that come to be as a result of negligence and improper care during antenatal care, all right, fetal growth and monitoring is also very important. Because maybe in the course of this interview, we're going to get to the point where I need to talk about the components of antenatal care. Because if you look at the WHO recommended component of antenatal care, you see that it gives room for everybody to be bettered well. So one of the reasons why we should put premium on antenatal care is such that we don't have complications resulting from not attending to antenatal care. Secondly, you can imagine that 65% of maternal deaths in Nigeria is as a result of pregnancy. And if antenatal care is being done well, all the possible high-risk pregnancies would have been identified, and something would have been done. The obstetrics emergencies would have reduced drastically, such that we won't be having our mothers die. We don't want to lose these people anymore. Hence, we should put premium
on antenatal care. Thank you very much. So let's just go on a little bit break. We'll be right back. Yeah. You're still on to the BetaLife show, brought to you by BetaCare Limited, a platform that revolutionizes doctor and patient relationship. Today's topic, we are discussing antenatal care, and with me here is my dear friend Adeyemo Oluwanifemi, and we've been discussing antenatal care. Now, we are looking at the next question I want to ask is, what are the factors that are responsible for Nigeria's poor antenatal care visits?
All right, one of the factors that are quite responsible is our culture and religion. For example, some people believe that when they are pregnant, they don't even need to go to the hospital. They don't know that in as much as pregnancy is challenging, even delivery could be very natural, but 1 out of 8 will have a complication. So the second thing is actually availability of healthcare facilities. You know, sometimes when the proximity of the facility is quite far, all right, from the mother, she probably will not be able to go to the hospital because she has several other things that she ought to do. All right, so that might be discouraging. Another thing is socioeconomic factors, all right, because antenatal care, even in our government hospitals, is not totally free, so to speak. So a woman that does not have the financial means to do antenatal care will most likely not embrace antenatal care, and she will just live within her means, all right, to ensure that she keeps living and deliver her baby. And another thing is availability of personnel. So you see, normally we should have the primary health care, the secondary health care, and the tertiary health care. But due to some policies, I don't want to digress, you know, the primary health care has not been well maximized. Hence, sometimes when these pregnant mothers get to some primary health care, they tell them doctors are not around, or the nurse, midwife that's supposed to attend to them is not around. So that discourages some of these pregnant women, and they don't even want to go back to those places. So I haven't mentioned that. I think these are the few reasons I feel some women don't come out for
antenatal care.
Yeah.
Yes. So now, the next question that I just want to ask is the components of antenatal care. What does antenatal care actually involve? So what does it consist of? What are the things that, for example, I'm newly pregnant, I don't know what to do. What am I to expect from antenatal care? Should I get to a hospital?
All right. According to WHO, okay, because I also want to add to what you said the other time. When WHO said 4 visits before antenatal care, except there is a need, all right, the first visit should be around 8 to 12 weeks.
Okay.
And the reason for that is because most women will not even know they are pregnant until they've missed their period, maybe the first month, and they still feel it's going to come back, and it's because they never did preconception care. If they did preconception care and they planned the pregnancy, in fact, the next 1 week after their ovulation, they should be expecting that. And because people don't do preconception care, some of them don't even know they are pregnant. They must have taken some drugs that could be teratogenic, that is dangerous to the baby. And these are the reasons why we have a lot of congenital anomalies, because they don't know they are even pregnant. I'm still re-emphasizing on preconception care. So during the first visit, which should be about the 8 or 12 weeks, there will be an ultrasound that will be done. Then the second visit should be about let's say 18 to maybe 24 weeks for fetal growth and development, to ensure that baby is going well. And another ultrasound will be done around that period. They usually do anomaly scan. For some people, the moment they see that there is a problem with the baby, sometimes they terminate the pregnancy. They are not advised to terminate the pregnancy.
These components are actually very important, because many of our women are not even aware of some of these things that they ought to get.
One of the components is health education.
Yes.
Because sometimes they don't know.
And
that's one of the things we're able to do through Preggo. Every morning, giving
out health information.
Health information. And before we knew it, some of them delivered while we were still on lockdown. Yes, in fact, there were some of them that, because of our interaction with them, were able to even detect preeclampsia. She had, because there are 5 significant signs to preeclampsia: headache, high blood pressure, blurry vision, pitting edema, whether the hand or the leg, then protein in urine. So proteinuria. So some of them were able to tell them, okay, if you have a swollen foot, all right, can you urinate in your water system? How is the urine? It's foamy. Oh, that's suggestive of protein. Okay, what about your vision? I feel headache and all. Okay, can you go to the hospital? Tell whosoever you meet on the road that you have a medical emergency and you need to see the doctor. And that was how we were able to save some of them, even during the lockdown. All right, so health education is also a very important component of antenatal care.
All right, so let's go on another break. We will be right back.
Hey, if you're thinking about seeing or having seamless access to a medical doctor, having a better healthcare service, or even meeting a health specialist, then you are probably wondering, do I need to go through the stress of traffic and spending so much time just to see a doctor? How about the long queues and overcrowded corridors at the hospital? How much money do I have to spend? Well, you don't need to worry, we have got you. With BetaCare, you can talk to a highly competent and unbiased medical doctor through video, audio or chat. BetaCare gives you access to professional prescription, drug delivery, lab orders and bookings, unlimited access to specialists, seamless payment methods, secure payment records and so much more. Our goal is to improve patient engagement, satisfaction and general well-being by providing secure and safe platform, 24/7 advanced care, affordable pricing and holistic care. Sign up today. Talking to a medical doctor has never been this easy. Everybody deserves better care.
You're still on to the BetaLife show, brought to you by BetaCare Limited, a platform that revolutionizes doctor and patient relationship. Today we are still discussing antenatal care and the importance and the power of antenatal care. So back to the topic that we have been discussing. Yeah. So what are a lot of women, we mentioned it from the onset, a lot of women do not know that there are certain diseases that can be detected and prevented during the course of ANC. Can you just help us to elaborate on that? What are the certain types of diseases that can be identified, because of antenatal care?
All right, so the most common one is malaria, because again, it's very rampant.
It's rampant and endemic.
It's endemic in our own society here. So malaria, some of them, it's when they come to the hospital for antenatal care that we'll discover that there is malaria in their blood system. And she could be complaining of fatigue and all of that.
Or she could even be bleeding, because usually the leading cause of miscarriage in the first trimester is usually due to infections, and malaria is one of the number one.
And malaria, because malaria that is poorly treated would lead to anemia.
Yes.
And the moment there is no
enough
blood flowing, don't forget the baby also needs
enough blood supply and oxygen.
And oxygen. So the moment there is no enough blood flowing, it reduces the strength of the placenta to attach well. And when the placenta is poorly attached,
starts bleeding and falls out.
There will be bleeding, all right, and
termination.
Probably will not. The pregnancy will not continue. Another thing is infection, as you've rightly said. Some mothers just feel that discharge during pregnancy is normal until they come to the hospital for antenatal care and they are being asked to do some screening. They will discover that. And infection, like you said, is one of the leading cause of termination of pregnancies. Another thing that could easily be disease condition that could easily be discovered is one we've been mentioning for a while now, which is eclampsia. All right. So during the antenatal visit, the routine tests that they do, for example, they check the vital signs, they check the blood pressure, the pulse, the SpO2, and all of that can give us a clue that, okay, if this woman has high blood pressure and she had done her laboratories, all right, for us to know that there is protein in urine, and we're already seeing some clinical signs that is pointing to eclampsia, so we can always quickly prevent such from happening. In as much as we are talking about the mother, what about the baby too, the fetus? So when they come for antenatal care and they do screening, serology, and we're able to discover that there is a particular virus in their blood, quick intervention will prevent such a viral infection from getting to the baby.
Yes.
There are some immunization or treatment that they will take. For example, someone that has hepatitis B, before 24 hours after birth, there are drugs that will
give it to the baby to prevent the baby from having
hepatitis B. Same thing with HIV. There are points where the viral load will be dealt with, and when the baby is being delivered, there are also drugs to give the baby that will save the baby
from having
HIV. Even breastfeeding pattern will change a little bit, but at the end of the day, we're able to prevent such from happening. So I think those are the
major yes.
But again, we can also talk about the things that can be discovered without mentioning hypertension in pregnancy and diabetes in pregnancy.
Yes.
So there's a difference between pregnancy-induced hypertension and hypertension in pregnancy. Same thing with diabetes. A woman that has hypertension, all right, before that pregnancy, it's hypertension in pregnancy. While a woman that never had hypertension before pregnancy and develops hypertension during pregnancy,
usually from 20
pregnancy-induced hypertension.
I think basically we've been able to cover a lot, and for our viewers out there, they will be able to know that there are certain things that can actually be discovered. And even another thing that I feel that people they take lightly is familiarization of the facility that is taking care of you, that is providing for you, because you know that, okay, you are familiarized. They have your medical history. They know that, okay, you are having high blood pressure, so they prepare properly for you. And it's not just that you turn up as an emergency somewhere else and they tell you that, oh, sorry, we can't handle this emergency as an unbooked patient. So it helps you to also know the capacity of the facility that is taking care of you. Can you take care of me if I'm going to have an emergency? Yes or no? Is it possible for me to have elective surgery on an emergency surgery? Is it possible for me to have access to blood if, let's say, I come in and I'm having placenta previa or something like bleeding or emergency bleeding during pregnancy? These are things that can easily be answered by just antenatal care visits.
Definitely.
So how can we improve antenatal care in Nigeria?
Fine. To start with retraining of the mind. All right. For people that have adhered so much to culture and religion, we need to have a retraining of the mind, and I believe that social media can help so much well. All right, on that aspect, people need to retrain their minds. All right. Another thing is telemedicine. To be honest, pregnancy can be very, very challenging for some people, especially the first time now. So imagine that the woman does not even need to leave her house. The basic things that she would probably do in the hospital is being done in her house. That's the investigations. All right. So they do telemedicine. They talk to their doctors over the phone. Instead of, okay, for example, the 4 visits that WHO recommend, she can have all the 4 visits in her house. It doesn't still negate the fact that she has done antenatal care. It's just that she has done antenatal care in another environment. All right. For example, BetaCare has a telemedicine platform that I'm aware of. So when she comes on the app, calls the doctor, for example, and the doctor says, okay, madam, how are you today? Ask questions. Okay, I need to see this blood test. I need to see this, and I need you to do a scan. In that, they don't even need to leave their house. So with that, I'm sure a lot of pregnant mothers that have issues with mobility and proximity to facilities would be able to participate and access antenatal care. Another thing is the restructuring of NHIS. All right, because the reason why some of them patronize traditional birth attendants is not just because of culture. Sometimes it's because of financial capacity.
Yes.
So if they don't have the ability to pay, and NHIS is able to help them, we'll have more people access antenatal care, and will reduce the complications of pregnancy. This has to do with government policy. Can we look again into the 3 stages of healthcare in the country? A consultant that should see maybe 30 patients that are critically in need of a consultant is now seeing 200 patients, in which 170 would have just attended the primary healthcare centers and they would have just been sorted. And I can't even point at any secondary healthcare facility anymore. It's just like we now have just primary that is not even functional, no equipment, and the tertiary.
Thank you so much, Adeyemo Oluwanifemi. It's been great having you on the show, and you're still on to the BetaLife show, brought to you by BetaCare Limited, a platform that helps to revolutionize doctor and patient relationship. Today we have discussed the power of antenatal care, and with me here I've been with Adeyemo Oluwanifemi, and we've been discussing the power of antenatal care. Now, about Preggo Mothers, how do we reach out to Preggo Mothers?
All right, for now we are still on the WhatsApp, and the best way to reach out to us is through our Instagram handle.
Yes.
That's Preggo and Mothers.
Preggo and
Preggo
Mothers.
being spelled as G-O, A-N-D, and the Mothers, T-H-E-R-S. So if you follow us, you send a DM, then we'll tell you how to, because we have to be the one to add you to the WhatsApp group. And for your information, it is free for all. Thank you.
It's free. It's free. Shadi, you are listening, Abi? Okay. All right. So about the last question that I want to ask is that are you working on any projects right now? Maybe yes.
I think we should give kudos to BetaCare, because they have a medicine platform already, where pregnant mothers can just pick up their phone, download the app, contact or connect with a doctor online, and much more than that. I mean, the big banger that is about to happen is a mobile clinic, so to speak, coming to your house, such that your ultrasound, your CTG, your laboratory investigations, and even if need be, ECG can be done in the comfort of your home. I mean, that is a big one. It's a big solution to the healthcare right now, because telemedicine already had a gap, and this solution is filling that gap.
It's bridging that gap.
So,
all right, so you'll be working alongside BetaCare to make this happen.
We already have something that is, in fact, we are almost ready.
Thank you. That's fantastic. I'm looking forward to it. And as we have already said on the show, if you have any concerns as regards antenatal care, you can reach out to Preggo Mothers, and you can also visit the BetaCare.ng platform. The details are right there on your screen. We will continue these conversations online, on our social media handles, on Instagram, on YouTube. Anywhere you are, we'll make sure that you can discuss, and you can also book an appointment with a doctor on BetaCare.ng. So you can click on BetaCare.ng on your mobile phone or even on your laptop, and you can book an appointment, reach out to a doctor, and now you can have your antenatal care visits done even right from your home. So we've come to the end of today's discussion, and hopefully you join us again next week, same time next week, on this same platform, where we'll be discussing a different health topic. So until then, stay blessed. I've been your host, Dr. Olawale Ogunlana, and this is me signing out, saying bye-bye.